Okay, good morning, everyone. Welcome to the April Government Affairs meeting. A little off schedule this month, so next month will come a lot sooner. My name is Rick Starboard, Rick's Auto Collision, and Chair of the Chamber. And if we could just go around the room, everybody introduce themselves, and then we'll have you folks introduce yourselves who are on Zoom with us this morning.
Rick Nelson, interim chief health inspector for the city of Lynn.
Lisa Tobin, public health director, city of Lynn.
What's you, Brotherhood Credit Union?
Hi, Michelle Damaris, Director of Operations for Bliss.
Glenn George, Lynn Ladder and Scaffolding.
Diana Trudis, Old Town Italian.
Christine Pierce, Columbia Insurance Agency.
Christine Niels with the Greater Lynn Chamber.
Harry McKay, Lynn Housing, Regional Services.
That New Holland Chamber.
Okay, John, we'll start with you.
John Kingston from St. Jean's Credit Union.
Nicole,
Hi, Nicole O'Brien from Roots Way.
Glenn,
Glenn Morris, Morris Architects.
Kevin,
Kevin Mello, Dunkin' Donuts.
Hilliard. Elliot,
He's
Okay.
on Mueller Shore Workforce Development. That's hired.
okay, good morning, everyone. It's great to have Lisa with us from the health department, who comes in periodically and gives updates on what's going on in the department, particularly when it comes to food establishments and inspections and all. So with that, we will turn it over to Lisa, and thank you for joining us once again.
Thank you for having us. So as you guys know, MoJin Food Inspectors is the contract food inspectors for the city of Lynn. They want to implement a quality control program on their own inspectors. So someone could come into your restaurant, the inspector comes into your restaurant, does their inspection, leaves your grade. A supervisor at MoJin knows that that inspector was just there, shows up at your establishment to inspect what the inspector did. It's to ensure that inspections are being done uniformly throughout the city, to ensure that inspectors are finding what they need to find, citing them correctly, and to ensure that the inspectors are treating the restaurant owners with good customer service, ensuring that they're out there to educate and not just have a hand slap. So we're just, we want to participate in that, and we think it's a benefit to our establishments in the city. So we wanted to make sure that everybody was kind of aware that it's a voluntary program. So if that second inspector shows up, you do not have to say yes. You can be like, no, I just spent 2 hours with the food inspector and I'm super busy, so I'm getting ready for something and I can't do it. There's no charge for that inspection. And that, most importantly, that inspection is not going to be a whole nother inspection. Like, you're not gonna have to sit with that inspector and walk around. They're not going to look for anything new. They're not gonna find anything new or change your grade or anything like that. It's literally a quality assurance. So we think it's something to benefit us, and it helps give us some feedback on how things are going out there. We've had a lot of good luck with MoJin, and they've been very receptive to what we need here in the community, so we wanted to work with them on this. So it's really what's going on with food inspections right now.
Every number was at every inspection.
We had no, so an inspector could have 10 inspections one day, and the supervisor just picked any 2. Yep. Yep.
Just unannounced.
Yep.
And how often are food places inspected?
So it depends on your risk base, which is identified on your permit type. So if you're a risk free, which is probably the most that we have in the city, that's 3 times a year. Yes.
Oh. Unannounced.
Yes, 3 times a year unannounced. And then when you have that first unannounced inspection, that's when you might say, ooh, this quality assurance program is in place. I might have a supervisor coming in to inspect that inspector today, but it would always be day of. I don't think it would ever be like a different day. That's
Hi. Any questions Oh, Michelle.
I,
Hi.
you don't have any background intel information, do you?
Just a lot of practice, Lisa. Yes, so this first inspector goes in,
Mhm.
finds what he finds.
Mhm.
Now, is this next inspector going in to see the inspector, or just going to go through most of the whole thing again? Or
So
like,
the first inspector will have no idea
oh,
if the second inspector is showing up. So, the point was, MoJin does not want the first inspector to know, oh, my boss is coming in right behind me, so I better do a really good job. MoJin wants to know what's going on out there, so the inspector doesn't even know when second inspector's coming. And they're gonna talk to the person in charge, say, how was the inspection? Do you mind if I look around? I see that they wrote this up, can I check it? Can I see what's going on? I wanna make sure they use the right code.
no cost to you.
No cost, and you can say no, I wanna make that very clear to people, I know it might feel like, another inspector on the same day. So if it's too much for you that day, if it's really busy day, because I know it seems like the inspectors just always show up on the day it's late, or the day pest control's there, or the day you have to serve 3,000 people at a luncheon, and it's always the most inconvenient time. So it is completely a voluntary program.
And do you offer that same delay thing when one of the city inspectors show up?
When you say city.
Like we do the time of year inspections, annual inspections.
MoJin does that.
Yeah,
Oh,
yeah,
okay.
MoJin does everything related to.
Oh, I thought they were just checking on.
No, MoJin is our inspector,
Oh, okay.
and MoJin is now inspecting themselves.
Oh, okay.
Yeah.
Are you going to send out something for the eateries?
Yes, yeah, absolutely. We're gonna have the food inspectors leaving stuff out, but we want to kind of get the word out first to make sure that the chambers understood what we were doing, so if people were calling you guys like, hey, what's this notice they just left me?
We can put that
Lisa,
out, our email blast.
I'm sorry, Lisa, can I ask a question? Are these
Of
new
course.
inspectors gonna come in with like badges from the city, or are they gonna say MoJin or?
Yeah, they'll have badges from the city like they do now. Yep.
Okay,
And they'll identify who they are. And quite frankly, that's one of the things that we want to make sure is happening, that the first inspector is showing up. Hi, I'm so-and-so, here's my badge. I'm here to do an inspection. Is your person in charge here?
so are they is it technically gonna have a city badge? Because just for, security and not letting any random people in.
Yeah, I believe our
say,
inspectors now have city
Yeah.
badges, so all our MoJin inspectors have city badges.
okay.
Yep.
Thank you.
How long have they been doing the inspection?
Oh, geez, a couple of years now. Yeah, at least, yeah.
First time I've heard that name.
Oh, MoJin,
Yeah.
yeah, probably because we don't really ever talk about it as the MoJin food inspectors, we just say the food inspector will be out, but technically we contract that particular inspection service out.
For the most part, it's usually the same two inspectors that, so when they walk in, it's like, hey, how you doing? Go do what you have to do, right? We don't follow them, we're like, just.
Oh, so you don't have to sit them.
No, I'm usually too busy, so it's like, just. Come here with
They
it.
know what they're looking for.
And they're very pleasant, very pleasant. If they do find something, like I have the, one license, I didn't print it, so the phone. I know you emailed me. I have to print it, put it on the wall. Yeah, he goes, you need it printed. Then I forget, when he walks to the door, I'm like.
That's funny.
That's funny.
Any questions regarding the inspection system? So Lisa, with the summer just, kicking off and outdoor events and all that. What are some of the requirements now? And we're gonna have one because we're gonna do the food truck festival again. That just got approved yesterday, but requirements when people want to do like outside events
So.
that are gonna have food.
Yeah, that requires a special permit. So that actually starts with the city clerk's office. And you fill out that application and that prompts, okay, what are you doing at this event? Is there food? And if there's food, then you come to Rick or April to fill out a food application and have the inspection process. And usually what we need to know is what are you planning to sell? Who's selling it? How are you making it? How are you hot holding it? How are you cold holding it? Are you using times, the temperature control kind of things. So we were just at the Kamai Festival on Saturday too, out there doing inspections, so.
And then, PM wash stations and.
Yeah.
Things like that.
Yeah, so it depends. So the food trucks might be a little bit different because they have hand wash stations inside the trucks. So if there's nobody like stands or nobody like cooking on site or having cooked somewhere else and bringing it on site, may not. So every situation is a little bit different.
Okay.
Yeah.
But it starts in the clerk's office.
Absolutely.
Like Sarah Bullock.
Okay.
She, that's
Yeah.
Okay. Anything else?
Do actually, this just came up yesterday. So, Lynn is part of the North Shore Public Health Collaborative. And we are working with them, so it's Lynn, Salem, Peabody, Danvers, Beverly, Marblehead, Swampscott, Nahat. We are working with them to sponsor a Food 101 training. So it's designed for people who are not expected to be the person in charge, who are not expected to have certified food protection manager, but just so that establishments have an opportunity to get their staff a little bit more trained on things directly from the food inspector. So there will be a number of sessions across the whole collaborative that people are welcome to go to. Spanish, English, Portuguese. I think we might have. You might have another language, I'll have to check. But we'll be getting you guys out flyers. Lynn will be hosting one at 10 a.m. at North Shore Latino Business Association on May 28th and at City Hall at 2 p.m. on May 28th. So I'll get all that information to you. Everybody is welcome to go to any one that they want. It's free. It's like a 1-hour training. And it will be taped, so we'll be putting it on TV too. Yeah.
What other programs do you do with the collaborative?
Well, we're doing the North Shore Mothers Visiting Program, which has been really successful. In terms of like group programs, there's not a lot. It's a resource on a regional level. So like if my epi's on vacation, I can call them and say, hey, can you cover for my epi? Hey, my nurse is on vacation, can you cover? Or we're running a flu clinic, can you guys send some nurses in? Or they'll call us and do the same thing, like, hey, your nurse knows a lot about certain disease. My nurse is new, can your nurse help train? So it's been really nice that way, yeah. So yeah.
What's the mother's visit?
It's a registered nurse who is trained in maternal health care. It is right now, it is any person who's given birth at Salem Hospital who was identified as a Lynn Community Health Center patient is referred for a one-time visit from the nurse, just to go out and see mom. And it doesn't have to be your first baby, could be baby number 10, it doesn't matter. She comes out, checks on mom, checks on the baby, just some blood pressure, weight, height of the baby. Kind of just like a postpartum screening, like how's everything going, how are the new siblings like adjusting to the baby. We have put a grant into the state and we're hoping to expand that to all moms in Lynn. So yeah,
And that's a one-time visit.
Yep, for every baby you have. And they come with gifts, they come with a big basket of great stuff, so yeah.
That's cool.
Wow, that is.
And we had a diaper drive in April for people who are in need of diapers, so we are doing that as well.
Anything else going on down there? Blood drives that you do?
We did have our blood drive yesterday.
Oh.
We just had our blood drive yesterday. We sponsor 2 a year, which has been really great. We are working with the Red Cross on a diversity donors program. They are looking for more diverse donors, and in particular, Black African American donors, to help make sure that they can identify blood donations that can better serve sickle cell anemia patients. Right, because the average, I think, sickle cell anemia patient could use 1 to 50 pints of blood a year, right? And the Latino community has they have a higher percentage of O blood, which is the most easily able to be used for other people. So looking to increase the number of Latino people who want to donate. So we're going to be working with Red Cross on doing some stuff like that.
Even when you run those, I didn't see that
Yeah.
one, but I just did the, Dave saw me.
Okay.
Them up
Yeah.
at the nights.
Yeah.
Almost monthly. I just did that one. But you know, you get those out.
Yeah,
and we'll push those. Is there like, does your department have like a newsletter?
yeah, we
or
do.
something?
We absolutely do. We'll get you guys signed up for sure.
Okay,
We put a lot of fun stuff in there, so usually we highlight the health themes for the month, we give like a different theme, I think last month was like sleep awareness month, and it was like, this is the benefits of good sleep, but we definitely give a list of calendars. We now, spring and summer's here, we'll be listing out like, follow the public health band, so you know where the public health band's going to be, because we always have swag. We list any upcoming events, we try to list any accomplishments from our team. So one thing that I'm super proud of, Candace McCrory was just trained. She's now a trainer in youth mental health first aid. So she can now go out to young people and train them to help other kids dealing with mental health issues, which I think is really one of the areas that we're highlighting through our community health.
and is there any training, like on first aid,
We are trying to get that off the ground. It is,
especially like we see what happened
yeah.
last week with the track meet there and
Right.
winning and.
Yeah,
Things can go south.
I've been working with Stacy over at the fire department on trying to put this together. Right now, it's a funding issue because not so much that it's Stacy's time, it's the cost of getting the certificates and the booklets. And we're kind of maybe like, well, can we offer like a community class where you don't really get a certificate, but we teach you like just basically, like how to do compressions, which they say makes just as much difference as, CPR. It's better than nothing. So that is, it's been on the plate for a couple of years, but it's there.
That's what saved that kid.
Yeah. We also carry an AED in our public health van. So when we're out at events, we have an AED with us on site. So even though I know 911 will respond quickly, we also have one on site. So, yeah.
When did you get the van?
Say that again,
When did you get the van?
2024.
And does it go to all events, or are you out on a daily basis?
So it's a transport van, so it's only 2 people can go in it, so we use it to bring our stuff places. But one day we were somewhere and I was like, we're public health, and if something happens, and people might run to us first while someone's calling 911, and I was like, 1080. Which I know that. It was like, Jesus, I don't want to be underground, so yeah. Got a lot of grant, but we, just so you guys know, in terms of the community, we've got a lot of grants out there right now to help us with the North Shore Mothers Visiting Program. We're hoping for a grant to come through the Bureau of Substance Abuse Services for social service navigator. So if someone is looking for, how do I sign up for health insurance, or I'm looking for childcare, this person can be someone that we can refer them to. We're also hoping it will be a nice bridge from the COM program. Are you guys familiar with COM? You're familiar with COM. You're on our advisory board.
Yes.
How was that meeting last night?
It was really nice.
Okay, do you want to tell people what COM is about?
So it's a police alternative, so instead of calling police for mental health issues or non-violent stuff, you will call the comm team and they'll help de-escalate situations.
So we're getting ready to celebrate our 1-year anniversary, June 23rd. Yeah, I think it's June 23rd. We will make sure you guys are aware, but it will be 1 year from our soft launch last year. We're seeing a lot of success. People list calls a lot for wellness checks, which has been really helpful. COM's gone out there. We were able to transport people to warming shelters or the Lynn shelter over the winter. We actually, and I thought this was such a great story, the Lynn police were out serving as a constable an eviction notice. And they were dealing with someone and she was getting very, very, very agitated and had 4 dogs. And like literally had to leave the apartment like in that moment. And Lynn police called COM to come help support that situation. Woman was probably having a panic or anxiety attack. Thought she was having a heart attack. We have a nurse embedded with COM right now 3 days a week. Nurse was able to do blood pressure and heart rate, heartbeat, and say, no, you're fine, like, which helped kind of bring this person down. So, the comp program is out there. We're getting the car wrapped, so hopefully you'll notice them a little bit more with not just the white van. But I think we're making a lot of inroads with folks calling and stuff like that, so yeah.
We did
Neighbor
get them
disputes,
come in about 6 months ago.
okay,
Faustine, and I could get the.
Javier, yeah.
Javier,
Mhm.
explain what was
Mhm.
going on, and how they try to de-escalate situations, particularly where that affects a lot of our members downtown. Where
Right.
homeless people hang
Yeah.
out with the entrances of these businesses, and they
Yeah.
kind of.
Yeah, we're also, that's a great point when you said the businesses, because we, the city as a whole has heard from the businesses about things being a little bit tough, particularly downtown right now. And there's so many different meetings on it. One of the things that we wanted to do, just something kind of quick but maybe helpful, is we are ordering, no trespassing signs to hand out to businesses for free. Because at least if that no trespass sign is up, you can call somebody and you have some kind of ability to have somebody remove off your car. But we're also creating signs probably about the same size as the no trespass signs that have the common information. So like if someone's walking by, or you're an employee, Kevin, if you're an employee at Dunks, that number's right there in the window for people on the outside to see, people on the inside to see, and you can call them right away. It's a small step, but nonetheless, it's just, we figure the more that we can put the information out there and get people to use it, it will make a difference, so.
That's what I'm saying now. Right now, if you needed the comp team, you would still call the police and they would send.
No, it doesn't go through police at all. There's a phone number for the comm team. It's something comm. I should know. I have it. I will give it to you. It's in my phone. But that's one of the things.
Just wondering.
We
how to
want-
get them.
Yeah, it's actually, it's a switchboard through Elliott Community Health. They will answer as the comm team. So they will take all that information in as the comm team.
Mhm.
That was one of the big points of the comm program was, I'm doing two things. Was, to make sure that it was a police alternative. They didn't want it being routed through Lynn Police, so the agreement that Lynn Police, the city and Elliott came up with was those calls would be routed and triaged through Elliott. There are times, I want to be very upfront, where if the call is something that we know comm cannot respond to, we cannot respond to a domestic violence call. That will immediately be sent to Lynn Police.
Mhm.
Somebody with a weapon, comm will not be out there for that. That's Lynn Police.
Mhm.
So it also is to make sure people are utilizing it correctly too.
Mhm.
So yeah, so far, knock on wood, it's been going well.
But when anybody calls,
Lisa,
they dispatch.
Correct, absolutely.
They don't turn it over.
No, if you call 911, you're getting City of Lynn. Yep.
Kevin's asking.
just, can you give me like an example of like when we should be calling? Because if it's like homeless people hanging out in downtown businesses, that's a literally daily, hourly thing. And, I don't want to overdo it with calling them. Like you just call when there's like an altercation, or give me.
I would say,
good
Kev,
example.
only, right, because I'm at your Market Street a lot.
Yeah.
I would say, if you're not having a problem, or if you, put it this way, if you've asked people repeatedly to
Yeah.
please, it's, you've been out here for an hour now, it's time to move on, and people aren't moving on, if people are being belligerent, if people are making customers uncomfortable, panhandling, if you feel that there are people doing something that's at a point where you can't, I don't wanna say tolerate, but tolerate it any longer, and that customers are going away, call comm. Most likely, I think the comm program, the staff knows a lot of those folks now. I mean, I know that even I recognize some of them. So, like I saw somebody one day and I called comm. I was like, oh, so-and-so. And when I was coming back out of Dunks, she had been sleeping and she had woken up, and I said, hey, so-and-so, is everything okay? I just want to let you know, I called comm. Do you need anything? And she was like, yeah, I need a cup of coffee. I'm like, all right, let's get a cup of coffee, right? So, comm is also empowered to do that kind of stuff. We've actually given them gift cards to Dunks to say, hey, what's going on? You're out here, you look hungry. Come on, let me go in, let me get you a cup of coffee or a sandwich, let's take a walk, talk, let's see what's going on. So, I think you're judicious and I think you're pretty considerate business owner. I don't think that you would overuse calm, but I think if you feel like there are people out there and they've done enough time in front of your business and you'd like them to move on and they're not, you give them a call.
Okay.
The call types is non-violent conflicts, non-criminal trespassing, non-crisis mental health, first aid, de-escalation for individuals in emotional distress, assistance for unhoused persons, connections to detox and harm reduction.
And the number is 781-905-CALM. That's the easy part to remember.
And I could email the flyers. Actually, that's on the website instead of email straight to the website.
Right?
It's involved with everything.
I know. We have, yeah, senior center is also very successful.
Senior center is moving along. We just opened the second floor. So,
Oh, nice.
yeah, so we have a lot more space, a lot more programming. We are looking to create, and Diana knows this, we are looking to create a space where some people will come and stay all day. And some people will come because they'll come Monday, Wednesday, Friday, because that's when the crochet club is. And then they're gonna go to crochet club in Peabody and Swampscott, right? So we wanna make it so that there's enough going on that people can come for pieces of time or they can have a stay the whole day. One of the things that we're particularly proud of over there is breakfast and lunch. We're the only senior center that does breakfast and lunch. Yeah,
So now they took over that terrace area?
it took over.
We have just now second floor is open, it's still kind of being shared, but.
Yeah.
they're Going to start.
Yeah.
They cleaned it up, I think, last week, and they're gonna start planting.
Oh, you're talking about the
Yeah.
garden patio, yes, they will use that space, yep.
Because we first looked at that, that was one of the
Yeah.
things, and then, LPS was.
Yeah,
So were they starting to trickle out?
some of LVS has already left and we are hearing probably by September. The rest of LPS will probably move to Market Street. I don't know what will happen with the other floors up there. I don't know if they'll be rented or if somebody else will move into it. We did actually also put up senior center parking signs. So whoever moves into that building understands that these spots are for the seniors. That was a little bit of a glitch for a while there.
And how's transportation working?
Oh, how funny you ask. So there's 3 vehicles there now, 3 vehicles. Public Health does have a community transit grant coordinator on site in Public Health. We just received our second round of funding to continue his work. His name is Nick. He's great. He is a graduate student he is a graduate of a graduate program from Northeast, and he's an architect. He's got a flair for kind of urban planning and transportation stuff. He did a survey down at the senior center to kind of identify what the transportation needs are down there, what kind of vehicles they prefer. So of the 2 that we have, they really only prefer 1, so good to know. But more importantly, we will be hiring a second driver. We've had Nick in his first year working as a driver over there to kind of pilot. How can we get people to come to the senior center longer? Like if we have more transportation, you can get to the senior center quickly or in less time than if there's 1 driver, right? Because 1 driver is doing all these loops. We have 2 drivers, so now you have basically an extra hour and a half at the senior center. So we're able to offer more programming. We have people engaged longer, people are not isolated as much, but we're also trying to say, okay, it's spring, it's summer, who wants to sign up for transportation on Saturday to this event? We know this event's happening. If you're a senior center participant, we'll pick you up, we'll bring you to the event, we'll keep you there for an hour. She's from Lifesaving. This actually came from her last year. She just left, but she's from Lifesaving. I forget her name. Sorry.
Oh,
Right, and she, this actually came from Lifesaving. And we weren't able to kind of pull it off last year quick enough, but it was definitely something that I thought was worthwhile, so we can get people to go to these events that are happening. We also provide transportation to the food pantry over at Bliss once a week. And we're looking into a small pilot program to provide like one-off transportation. So you come to the senior center in the morning, you have breakfast, you've already registered and scheduled yourself that you need a ride to Salem Hospital for a doctor's appointment. We drop you off, we can pick you up. back to the senior center, you spend the rest of the day at the senior center. So we're working on trying to pilot like small opportunities to move seniors around a little bit more and hopefully parlay it into something bigger.
Does the ride do any transportation? Take people down, pick them up?
Some people take the ride. Yeah, I think, it's because they have the senior center transportation that brings them directly, they find they get there faster. So, but yeah, but definitely like an ability to use the ride as a resource that you can obtain through the senior center or Forest Cliffs, so.
And attendance is still good down there?
It's still very good. The only problem with the ride is, let's say you said, I want to be at the senior center at 8:30, they may pick you up at 7:30 to get you there, so if the senior center's not open, they're standing up. Or if you want to be picked up at 3:30, they may not show up till 4 o'clock, so that's some of the issue with the seniors, so it's that timeline between. But the vans we have at the senior center right now.
Yeah.
I mean, that's great, because that was, such a long time coming for a city of the size to
Yeah.
not really have a place like that. Diane, how much you put into that time on the council? Michelle, things like that, and the city committing to it.
So you pick up the residents who wanna go there?
Mhm.
Wow,
Yeah, we bring them home.
how big of a van is? I've seen them on a list, a lot of people come out.
So one is a 14 passenger, I think we have two 14 passenger vans. No, one is a 14 passenger, one is like an 8 passenger, and one is like a 6 passenger. Two can accommodate wheelchairs. One is a regular like passenger van, which is not as easy for the participants to kind of maneuver through, but it works. And it does allow us to cut down on cost of hiring a coach bus to go to a restaurant, like they do a restaurant outing once a month. So now that we have more than one van, everybody can get in 2 vans instead of having to hire and make it into cover something. Yeah,
A local place to go to is the library too, because sometimes they do learning gap,
there you go.
and they do have family coloring day, so.
Yeah, that's
it's a nice
great.
Place to go.
That's a great point. Yeah, that's the kind of stuff we want to do too. Like, we're also looking into something as simple as, hey, every other Thursday we go to Market Basket, so you can sign up, right? So like, if it's hard for you to food shop, or you walk, or you take public transportation, you can do your food shopping. And we also have a refrigerator at the senior center that we can allow participants to leave their groceries in to keep them at town, right? So when we go to the food pantry, they pick up their food, they go back to the senior center, they put it in that refrigerator, and it's held correctly for them until they go home. So, yeah. Yeah, it's
How many senior centers how many senior residents think you have a day per se?
I think we're averaging like 80.
Yeah. That is my.
Yeah. It's a lot of people, and I'll tell you, it's a lot of people who come and they spend the day. Most people are not coming in, doing something and leaving, they're spending the day.
We have a lot more activities on them, and now that the second floor's open, the exercise rooms upstairs,
The digital lab.
the digital labs up there,
It's really a mental health.
the craft room is. Have a long life.
We're also getting our digital equipment mounted on the walls, and what we're going to be looking to do. Again, it's been on my list for a bit, but it's getting there, is virtual senior center. So if for some reason you can't go to the senior center, you're sick, that we've had some people who stopped coming because of ice being in the city and they haven't wanted to leave home. You can zoom into the senior center, right? So you can still participate with your friends, even though you're from home. So, yeah.
Chair yoga is the #1 thing now.
Chair yoga,
I have to
yeah,
be there with a different one.
chair yoga.
Oh, really?
We have it in my room and it wasn't big enough. Because more participants keep coming than yoga, sit right in that chair.
Yeah, and that's actually funded through a Title III grant from this. So, I mean, I think that kind of talks about the cooperation, like the senior center works cooperatively with GLIS. It's one of its biggest partners, so we do a lot of different things.
It's funny, every time I meet an elderly person, I'm like, yeah, just do share yoga. It only not offensive, but yeah.
You can't run a 7-minute mile, but what's your best mile so far?
8 minutes.
Oh, okay, look at him. He's gonna get it down. I see this kid running.
Any other questions for Lisa or Rick? No? Well, you guys got a lot going on,
We do.
even more than I thought. I thought we were just gonna talk about food service. but that went quick, so I'm glad we're able to fill the time with other things. Anything to add?
No. No, Rick is doing a great job as the interim. Just so you guys know, April Peralta is currently down DPW doing some work down there, helping them. Rick is in her place, still handling all the environmental health stuff, and I'm kind of just here to make sure that he's not panicking too much. Rick's our guy, and he's doing a great job, so it's been a role that he just kind of stepped into, so this is all food and everything is new to him, and he's just doing it.
That's awesome.
Great, and before we let everybody go, I just want to touch on a couple of upcoming events. May 12th, we have a breakfast networking event at Brew North Cafe on Linfield Street. That's the new coffee shop that opened up next to Superior Roast Beef, kind of at the entrance of Great Woods Road to the golf course. Back on schedule for the Government Affairs meeting on May 13th with Council President Coco Allensug and Vice President Fred Hogan. To talk about what they've done since they've taken over those roles in January. We have noontime networking at the Lynn Tech Tigers Den on May 15th, so that's gonna be a busy week. And for anybody who hasn't had lunch at the Lynn Tech Tigers Den, you're really missing out. So that'll be on May 13th at 8:30. No, I'm sorry, 12.
You gotta mention Prime Rib on Thursdays.
And
Oh, yeah.
Prime Rib on
Thank you.
Thursdays. They do have a great menu there. And then we also have on May 21st, the spring soiree, after hours at Brotherhood Credit Union. Want to touch on that?
Nah, I didn't know what's going on.
So we do, have a lot going on, and while it really hasn't gone out, yet, because we just got approved by EDIC yesterday, September 26th, we're gonna do what will be the second, hopefully, annual food and beer, festival down at the ferry terminal.
Golf tournament,
Oh, golf tournament
August 24.
on a date that I can't make.
What?
I'll be in Greece.
Oh, well, you can sponsor.
Oh, we don't care about you.
Did you say you'll be in Greece?
Yeah,
Oh, good for you.
yeah, it's going to celebrate our 40.
Good for you.
Do you wanna talk about the ribbon cutting on May 7th?
We got that, Touchstone,
Okay,
Yeah.
you wanna mention that?
it's,
Because that wasn't on.
are they on Market Street?
I think it's exchange.
Yeah, they already.
Oh, is that, Edison building.
That-
The Edison building.
Yeah, that was announced
Yeah.
yesterday, it wasn't on the Facebook page.
Yeah.
So, we have a lot going on, hope to see everyone there, and, have a great day, thank you for coming.
Thank you.
Appreciate it. Keep the lines of communication open.
Your son was so cute for that age.
Diana's granddaughter's on the team.
They just